Got quite a lot to get through this evening, so it's good we're going to start on time. But first of all, a big good evening and welcome to the Results UK Grassroots Conference for July. Look, I don't know about you, but I really do feel that the year has gone by really quickly. We are halfway through. I hope that you're keeping safe and well, and in spite of all the continued restrictions, you've been able to enjoy a bit of the sunshine. For those of you who don't know me, if we haven't had a chance to meet, my name's Aaron Oxley. I'm the Executive Director of Results UK, and so I'd really like to welcome you to the call tonight. I'm going to start with my usual reminder that we do record these calls. We post them on our website so that anybody who couldn't make it tonight can catch up later. Please do feel free to turn off your video if you don't want to be on camera and on the recording. We're going to use automatic captions as well. You should be able to turn those on and off using the Zoom menu bar as well. Now, look, if there's anybody who's new to Results that's on the call this month, very special welcome to you. Please do feel free to introduce yourself either verbally or using the chat function. We'd love to hear where you're calling in from. This is, of course, optional, and I'm not sure if we have any new folks that are willing to turn off their microphone and say hello to everyone. And hearing none, if we do have new folks that don't want to turn off their microphone and say hello to everyone, do of course feel free to put your hello into the chat box. So please do keep yourself muted during the call, and the chat box is more than just introducing yourself. If you've got a question or a comment, please do use it. We've got people watching that, and they'll try and pick up anything that gets raised there, either in the chat or raise it up so that whoever's talking can speak to it. We're going to follow our normal format tonight, which is going to start off with an update from me on what's been going on in the world of international development. Then we're going to have the usual roundup of grassroots activity in the UK before introducing our guest speaker, who I notice is already on the call, so that's great. And then we'll go into taking questions and answers from him. So since our last call, a lot has happened, both on the UK's aid and development agenda, also around the G7 Club of Nations, which met in Cornwall about 3 weeks ago. Some of you will have seen an email update from me on the 15th of June, setting some of this out. So apologies to those that have read it, you now get to hear me say it, but we're going to put a link to that email into the chat box just now so you can follow along. So the first thing that I mentioned in the email was the disappointing UK announcement on funding for the Global Campaign for Education, or GPE for short. £430 million was announced. That might sound like a lot of money, but it was £170 million short of what we think is needed to do a proper job of ensuring access to education for all children, especially the most marginalised, such as girls and children with disabilities. If you were able to take our action back in March, a big thank you. The GP's funding conference still has yet to happen. It's happening at the end of this month. So there's still time to influence the Prime Minister to increase the UK's pledge. Now, he's made so much of his support for girls' education, and so it's really important that he continues to hear messages about the gap between his rhetoric and the reality of the impact of the UK aid cuts, including and especially on global education. And so while it's not our main campaign action this month, if you have the opportunity to write a quick message to the Prime Minister, please do so. We've created a template letter which can be customised to include your own reasons for supporting global education. So please do share this as widely as possible, because in the next few weeks, your actions could really make a difference. We're going to put a link to that template letter into the chat box right now. So as most of you know, we've been closely following political developments around the UK aid budget. And as I also emailed you last month, we were hopeful that a vote to restore our aid budget to 0.7% of gross national income, or GNI, would be called in Parliament. Unfortunately, because of some parliamentary procedure stuff, that didn't happen. However, there was a debate in Parliament on the 9th of June, but that one didn't have a vote. Nearly all of the speakers in that debate spoke passionately and articulately in favour of restoring the 0.7% target. It was very heartening. And the rebel parliamentarians still believe that they will win a vote if one is called, and they are looking for other opportunities to defeat the government. Now, we've seen contradictory media reports this week about whether the government is likely to make concessions on this issue or not. Some say the Chancellor is holding out against any increased expenditure, and others say the Prime Minister is concerned about the unexpected amount of political damage that this is doing to him, both on the global stage and at home in key constituencies. Well, we don't know what's happening behind the scenes exactly. We're still convinced that this is absolutely something that we can win, and it remains really important to keep demonstrating public support for aid. This keeps up the pressure and helps keep the parliamentary rebellion strong. One piece of really good news is the government seems to be wrong in its assumption of how popular the measure to cut aid would be in the UK. While polling initially showed that most people were in favour of the cut, since then, more recent polling has shown that public support for aid has actually increased by an unexpectedly large amount, possibly because of the debates about the impact of the cuts, or possibly relating to the challenges that people are seeing in the world caused by the COVID pandemic. Again, we're going to share a really great article which discusses this in the chat. So now I really want to mention last month's G7 summit. With your help, we've been asking for leadership on the COVID-19 pandemic and for help to build back stronger health systems. And last month, we asked the UK to commit to sharing its spare vaccines with countries that can't afford them as part of wider G7 efforts. Shortly after we launched our action, the government announced that it would donate 100 million doses of COVID-19 vaccines within the next year, 5 million of those before the end of September, and 25 million more by Christmas. Importantly, they're not cutting anything else to do this. This will be on top of the current smaller aid budget, which was a key part of our ask, and that part of it is a meaningful win. So overall, this is a welcome step in the right direction, but a very small one when you compare 100 million doses to the size of the need and to the number of doses the UK has already ordered. So in this month's action, we're asking you to follow up that commitment, asking the government to go much further and much faster. The UK government must also commit to longer term and more sustainable actions. Dose sharing is hopefully just a one-off, but we also want them to share knowledge, technology, and intellectual property to enable uninterrupted production and supply of COVID-19 vaccines in lower and middle income countries. All of this is set out in more depth in our June and July action materials, and there's a lot we can do to improve the government's response. So good luck with your campaigning on that. Now, the G7 summit communique did include strong language on the importance of health system strengthening for future pandemic preparedness, but this wasn't backed up with solid commitments on what creating resilient health systems should look like, and missed an opportunity to make progress on the key building blocks, such as routine immunization for every child, proper nutrition services, and better prevention and treatment for infectious diseases that aren't COVID. And we'll be discussing more about what the G7 did and didn't achieve on the COVID-19 response in just a few minutes, but we're going to put the communique in the chat now. Now, tuberculosis wasn't mentioned at the summit, which is disappointing, particularly when taking into account the disproportionate impact of the pandemic on critical TB services. 18th of July, just 12 days from now, sees the 100th, that's 100-year anniversary of the BCG vaccine. It's the only vaccine that exists for TB and one that has only limited effectiveness. We're using this historic moment as an opportunity to ask world leaders to apply the same level of urgency to the funding of newer vaccines for older, neglected diseases such as TB that have been given to the COVID-19 pandemic, for which safe, effective vaccines were made available to people in under a year. Look out for a blog from us on that next week and follow our social media for more activities around that 100-year anniversary. The G7 did draw attention to the rising state of malnutrition due to COVID-19 and called for investments in food systems and nutrition in order to reach Sustainable Development Goal 2 on zero hunger and World Health Assembly nutrition targets. They also encouraged strong commitments in these areas to be announced at the Nutrition for Growth Summit later this year in December. So we look forward to seeing leaders honour this with special financial and policy commitments later this year, even though we remain incredibly concerned about UK levels of nutrition financing. Moving on from the G7 summit, although Results isn't an organisation that tends to run demonstrations of public protests, we do firmly believe in the right of citizens to raise their voices about the things that they care about, all within the law. We share the concerns of many about some of the clauses in the Police, Crime and Sentencing Bill, which was passed by 100 votes in the House of Commons yesterday evening. It does feel like this bill poses a real risk to the rights of individuals, and particularly some minority groups, to campaign for change. And on the whole, we're seeing a current government which has a very poor record of listening to people and responding positively to positive campaigning. So we are watching this passage of this bill with a degree of concern. And we're going to put a link up to that in the chat as well. That's it from me for now. I'm going to hand over to Ruthie for the usual roundup on all your activities around the UK. Over to you, Ruthie.
Thanks, Aaron, and apologies that I haven't got my camera on. I don't trust the Wi-Fi tonight. It's been a bit dodgy, so I'd prefer to stay on the call than have the video on. So yeah, this is an exciting roundup because we've got a lot of things to launch and share with you. And first, I'm going to just mention, we'll put a link into our newest blog post, which is called Barefoot and Begging, Pity Communications Do Everyone a Disservice. And this came about because a few weeks ago there was a cartoon in an article about the UK cuts to aid, which depicted overseas development assistance, the official term for aid, in an outdated and offensive way. And this prompted Della and I to write a blog exploring the portrayals of aid and people living in poverty in low and middle income countries, and why and how we must move away from outdated and offensive portrayals. So this links with our wider anti-oppression journey that we really encourage you all to be part of. So please, check out the blog and take the opportunity to consider how we talk about and represent aid in our campaigning, whether that's talking to each other or to politicians or on our social media. And I'm also pleased to share with you our new welcome pack, which is an overview. I'm just going to share my screen. Moment of truth. Can you see the welcome pack? Great, okay. So it's an overview of what volunteering with Results is all about, and an introduction to Results as an organisation as well. So we'll be sending this to prospective and new volunteers so they can have a better idea of what volunteering entails. But also it's a good resource to look at and keep because it has lots of useful information and links to videos, campaign guides, blogs and more. So you might learn something new about Results. So whether you've been involved for years, months or weeks, give it a read, and you should be able to have a bit more of a look through if I scroll through and then leave the rest for you to do in your own time. The next thing I'm going to pop on the screen is our updated interactive map of campaign groups. So now you can click on a campaign group and see the relevant social media links, some photos, a bit of information, and you'll notice that we have a new group in Swansea, which is really exciting. And I think we've got Yao on the call who is starting the group, who is just going to say a few words. So Yao, over to you if you're there.
Yeah, I'm here. Yeah, I'm Yao, a student at Swansea University. I'm studying a Masters in Public Health and Health Promotion. And we've started a group in Swansea. Actually, I contacted the Swansea Council for Volunteering Services and I linked them with Rudy. And then she has actually designed a message for them to use to advertise Results in Swansea. So I would say we are, but I've also talked to some friends who are interested. So hopefully we'll start our first meeting this month. And then we're also planning on organizing an event this summer. Also, I've also contacted Swansea University, the newly elected student union secretary. And we want to also make it like part of the student associations on campus. So I think what I've been doing over a month or two is just to find avenues to advertise Results so that a lot more people will be familiar with what Results is about. And I think with time, the group will kick off and then more activities can be done. Yeah, so basically that's what we've been able to do so far with the help of Reese and the wife and then Rudy.
Thank you. And thank you for all your work. You've been so proactive in approaching places. And if anyone on the call knows someone in Swansea who might be interested in joining the group, then send us send them our way, and you can send them our nice new welcome pack as well. So from our newest group to our longest standing group, I'm now going to hand over briefly to Rosemary from the Cheshire, formerly known as Macclesfield group. And Rosemary's going to give us an update on their in-person meeting that included some Wave of Hope craftivism, which is a term that is used for like craft and activism together. So Rosemary, over to you, and I'll get the photos up.
Thank you, Ruthie. Hello from Macclesfield. Well, while the G7 world leaders were visiting the Eden Project, us ordinary folk met up in a local park at the cafe. Tyra arrived with a trolley full of paper, pens, scissors, glue. Fantastic, she'd thought of everything. Jay's family arrived with some tasty bhajis, kindly made to share too. Lovely. So with mugs of tea from the cafe, we got to work creating our Wave of Hope. And sometime later, with inky, sticky fingers, we had a collection of waving hands creating a large banner. And we all knew each other a little better, which is great, especially for those of us who've only recently joined the group. A passerby helped us take the photos, and as we packed up, the cafe waiter appeared and said, "So what have you guys been doing all afternoon?" So we hope he's going to join us. So it was a great way to spend a couple of hours in the park, and brilliant to meet most of the group face to face at last. I think the photos have appeared on social media and in the local paper, and if they help get the message through to the politicians who need to hear it, that will be even better. Some of us are also planning to join in with the Coat of Hopes project as it comes through Macclesfield on its way to Glasgow. Thanks.
Thank you so much, Rosemary. It looks like it was a really lovely evening and also productive. Not evening, afternoon, wrong time of day. So yeah, as restrictions are starting to ease, we know that most of you will start to think about meeting up in person again. And just a quick reminder that it's really important that when you are meeting or carrying out any results activity, that you do so strictly in line with government guidance and also taking into consideration any specific local regulations for your area. We have recently updated our Grassroots group guidance document, which contains ideas and resources on how to be part of an effective, safe and sustainable group. And this includes areas such as safeguarding, inclusion, insurance, and looking after yourself as an advocate. So take a look through and keep a record of it, because it's an important resource that you might need to refer back to now and again. So although things are changing with COVID-19 restrictions, our national conference this year will be held virtually over Zoom, and it will be the weekend of the 11th and 12th of September. So the sessions will be split over 2 half days, with sessions on Saturday starting at 9 AM, finishing at 2:30, and Sunday starting at 1, finishing at 6:30, with plenty of breaks in between. And this year we've added something new to the virtual conference experience and made a website, which I'm going to put up just there. So here is everything you need to know about the event. So it's like a conference one-stop shop. And we're excited to let you know, as you can see in the illustration, the title of the event is I've ruined the big reveal. Take a stance and find chances for change. So this year we'll be looking at how the pandemic and the UK government's decisions and attitudes over the last year or so have been reshaping how we campaign and what we campaign on. So the National Conference is an opportunity to hear from expert speakers, attend training sessions and workshops, and network with other advocates. So on the weekend of the event, this website will also be a platform to talk to each other between and after sessions in forum spaces and through comments and interact on polls. So you can register now. Registration is open. So registration's through Eventbrite, and you can click through from the website onto that. that was slightly slower than intended. We'll go back to the main site. And there's also a draft agenda which we'll be adding to. So this will sort of be live, constantly changing as we have new speakers announced. And this year marks 35 years of results in the UK. So we're starting to collect some dates and quotes, photos, memories of results past and present. So this is a work in progress, but if you have anything you'd like to add, please do send me an email, and hopefully by September we'll have a nice collection to look through. So yeah, go ahead and look through, register, and yeah, really looking forward to sharing with you more of our plans and seeing you at the event as well. So that's all from me. Thanks everyone, and back to Aaron.
Thank you, Ruthie. That's great. I'm so excited about all of this. There's going to be some very embarrassing photos of me coming on that timeline sooner or later, I can imagine. But let's jump onto the topic of tonight's call. It's to follow up last month's very rich discussion on the importance of a fair distribution of the world's supply of the COVID-19 vaccines. The G7 leaders' collective agreement to donate 1 billion COVID-19 vaccines over the next year, of which they've only got 870 million actually pledged, has drawn criticism for being 10 billion doses short of the number we need to end the pandemic and for lacking transparency. Now, as we heard last month, the statistics on vaccine inequity are very stark, and lots is needed to ensure a fairer way to develop, manufacture, and distribute public goods such as vaccines. So to look at the advocacy needed to achieve a fairer distribution of these urgently needed COVID vaccines right now, we're delighted to have with us Waiswa Nkwanga, who is Senior Associate at the Action Partnership Secretariat in Washington, DC, where he is the focal point for tuberculosis, the Global Fund, and Research and Development for Global Health. Waiswa is a born and raised East African and attributes his passion for international development, human rights, and global health to his life experiences growing up at the height of the AIDS epidemic and civil wars in the region. Waiswa holds an MSc in International Development and Humanitarian Emergencies from the London School of Economics and a BA in Political Science from the University of California, Berkeley. Waiswa, welcome to our call. It's really lovely to have you with us this evening.
Thank you.
So thank you so much for joining us from Washington, DC, where I know it's the middle of your working day. So you've been on the call since the beginning, but let me introduce you people on the call anyway. You have volunteer campaigners from all over the UK, from Scotland to the South Coast, all the way over in Wales. Lots of people who are very familiar with campaigning on global health issues, in some cases for many, many years, as you've seen for the timeline, and also some who are very new and are starting to learn for the first time about the barriers that prevent everyone from having fair access to the benefits of health systems and health interventions. As many of you know, Results is a member of the Action Global Health Advocacy Partnership, 13 organizations all around the world that do work on global health. Waiswa and the team in Washington are very close colleagues and friends, and we coordinate with them pretty much on a daily basis. Now, Waiswa, as you know, we always start with three pre-arranged questions. We've shared those with you in advance, but before that, I'd like to give you the chance to introduce yourself, to share a bit about your background, your professional role, and importantly, what motivates you personally to be active on the topic of global health?
Thanks, Aaron, and I'm glad to be here, and thanks for everybody. I know it's already late in the UK who is taking their time to be on this call. As Aaron mentioned, I'm from East Africa, I'm from Uganda, and you know, I grew up around the AIDS epidemic in late 80s, early 90s, and I saw firsthand family members being affected by it. And I grew up with that fear of, you know, it could be me next time. And, you know, and then, you know, in the early 2000s, I left the country and had the opportunity to come to the United States and have an education here, but also in the UK. And then, you know, the whole time I was in the UK, I was wondering what my path was going to be because my training was very broad. But somehow health really seemed to be the most common theme for me, that the whole time I was there, I was always writing about health. I was always talking about health, and I didn't really realize how much of this had been influenced by my childhood. And so when I started working in global health, I really wanted to make a difference. I really wanted to solve the problems that I saw growing up that to this day have not been addressed. And so that's what motivated me to work in health in general. But I also care about, obviously, the entire development industry that we work in, because we can't talk about health without talking about economics. You can't talk about economics without talking about political challenges that countries face in their own context. So, that's, for me, it's all together, and I'm glad to be part of this conversation, and happy to answer any questions that everybody will have.
Thanks, Waiswa. It's always so powerful to hear people's personal stories, and that's the first time I've heard yours. So even though I've known you for many years, it's great to have you sharing in that way. So let's jump to the first of our pre-arranged questions before we open the floor. For those that want to text in a question, you can do that. It's 0777 561178. We're putting that in the chat because some of you may not have easy access to the keyboard. You want to text something in, that's totally fine. Otherwise, do feel free to pop your questions in the chat. We can build some up while Wace was asking the first 3 pre-arranged questions, so don't be shy. But while everybody's thinking of those things, we're going to go straight to Birmingham for our first question. So Birmingham, take it away.
Hi, I'm going to take that one. So the recent G7 meeting of the rich world leaders agreed to share 870 million doses of COVID vaccines, at least half by the end of 2021. Why isn't that enough?
So, I mean, it's not only the EU that has agreed to share. The US is sharing about 500, or say they will share by the end of the year 500 million doses. I think the UK about 100 million they've committed to, and others are also chipping in. But if you look at the size of the problem, this is not even a quarter of what is needed. Low and middle income countries, these are countries that are known either have limited capability to produce vaccines or don't have any at all. It's estimated that they need over $10 billion to cover their populations. And, if you put together the nations that we have right now, it's less than 2 billion. There is an additional 2 billion that COVAX, which is a platform that was established last year to help bring about equitable distribution of vaccines, has committed to distributing about 2 billion by the end of the year. And we're still not halfway, to help countries vaccinate their populations. So, it's not enough to donate at this point. I mean, it's necessary, obviously, we need people to donate, countries to donate doses, but it's not enough to address the need. And so we need to go beyond that. We need to look at ways that we can countries can transfer technologies to low and middle income countries. That conversation obviously is happening now with the TRIPS waiver that the United States initiated. Countries like South Africa and India have been pushing this because they do have the capacity to manufacture and scale vaccines, but other countries need to come on board. It's, we need the EU, we need the UK and other countries to support these efforts. And so far they haven't been supportive. And, so there's that argument, but then there's the argument of what it means for low and middle income countries economically if they have to pay for the vaccines full price. And I think it was Oxfam that estimated that right now, if there was a waiver, the waiver on intellectual property rights, if it was made available to countries to produce vaccines, that it would cost them about $6.5 billion, or about 4.6. But without it, we're looking at $80 billion on these countries that have really weak economies. And so there is there's a need for donor countries, for rich countries to step up and support these efforts. The other issue with this is that it's not actually clear. There's a lot that is unknown about these doses. Where are they coming from? Are the donations that countries are committing to actually new, or is the funding that will pay for that coming from existing commitments? And for example, the US has made the commitment for the pledge for $500 million, but from Pfizer, but the money they're going to use, they're planning to use to purchase this, is coming out of the funding that they gave to Gavi last year. Gavi is one of the partners that are part of the COVAX that I mentioned earlier. And it's going to cost about $2 billion away from Gavi. Gavi got $4 billion from the US initially, and they were going to use that money not just for vaccines, but also for treatment, for diagnostics and other things. And now they don't have that much, don't have much money left. So, we need transparency around those donations, and we need countries to reveal, how they're going to pay for these things, when, and on what terms. I think that will be really something that will help increase our ability to scale up and have vaccines available to people who need them the most in places where they can't make them.
Thanks, Wesa. Great answer. We are going to go across to Stort Valley for the second question.
Hi, Wesa. My name's Corinne. It's really interesting to hear from you. I would really appreciate your advice when people say to us that our first duty should be to fully vaccinate our own population before we share the vaccines internationally. What do you think we could say to them? What would be a good response to help them understand?
I mean, a quick response from me, off the cuff is, we're in this together. But, in terms of, and this is, I'm going to talk about this for me, I understand where people are coming from. The way we have shaped government is around territory. And so, there's always, this is the way things have been, and this is how they are. And so the first response to every government is, they think, or we believe, that is to their people. But if there's one thing we have learned from this pandemic, is that viruses don't care about territory. They don't respect them. And, protecting people in other countries actually then becomes a protection for us as well. As the virus came from a different country, and it probably has done more damage in other countries than even in the country where it came from initially. And so, we're in this together. This is our fight, all of us. But there's also, the fact that it is possible that we're seeing a lot of variants coming up. And so it is possible that there will be a variant. If we don't actually contain this virus now with the tools we have, there could be a variant that current vaccines cannot protect us against. And then rich, poor, wherever you are, we will find ourselves in the same place where we were last year. And I think that would be a mistake since we have the tools. Right now, rich countries, sitting on piles and piles of vaccines that they don't need. Canada alone has purchased, I think, like enough vaccines to cover their populations 5 times. The UK enough vaccines to cover the population for 4 times, and the US twice. You know, to be fair, I know that these investments were made before there was a vaccine. So countries are basically betting on different, potential producers of the vaccine. But now we have an effective vaccine that we know that work, a lot of them that work. And we need now to focus on getting vaccines to people and populations that need them the most around the world. We have a moral obligation to do that. And, I don't know if many of the people on this call know that right now, there's the Delta variant has taken hold in Africa, and people are dying. In the last 2 weeks alone, I've lost 2 members of my family in Uganda. Africa had survived this for a long time, but already it's there. And these were in there, the 2 people I've lost were in their 80s, and one of them was 80, another one was 76, I think. And, I am really scared. And, I keep calling my parents every day to check on them to find out, if they're okay. And I can feel and get the sense of fear in them, the fear that I only recall from my experience with HIV, where people are like so fearful, but also feel helpless. And they just kind of like waiting for their time. They kind of like giving up. And I'm like, we have vaccines being produced right now. We have countries here in the United States. The United States is offering all kinds of incentives to 18-year-olds. They're offering them scholarships, lotteries, free meals, beers to take the vaccine. And as far as we know, we all need the vaccine, but there are some populations that are more vulnerable than others. And so the fact that, we are going as the United States, we're going out of our way to create all these incentives to cover people who are maybe less likely to be affected to die from this disease, while people in their 80s, 90s, in other parts of the world are completely without any help. I think it's shameful. I think that we should prioritize these populations now, not a year from now, but now to make sure they get the vaccine they need. So that's a moral argument. There's also an economic argument. Countries are keeping piles of vaccines, but that strategy actually is not very helpful from an economic, beneficial from an economic standpoint, because these vaccines have a shelf life. At some point, they're going to expire. And if they expire, they can help nobody. And so why not give them to people who need them? There's also I've heard some people say, companies will be in the future will not be interested in investing in crisis like this because they're not making enough money. So we can't encourage countries to give away. But the thing is that these vaccines have been paid for already. So companies have nothing to lose at all. And it does not disincentivize anybody else if these vaccines were given away. And then lastly, if you think about it in terms of economic benefit broadly, one of the things you will see is that because of this pandemic, rich countries have actually suffered a lot economically because they rely on people moving around. They rely on a lot of importation of goods and things like that. And a lot of the things are not happening, at least not at the rate that they used to. So opening up, making sure everybody's safe is in the interest of this country's economic interest long term, because it opens up travel, it opens up trade. This thing will pay for itself over the long term. And I think it's the right thing to do.
Thanks, Weswa. That's a very comprehensive answer, touching on so many different and important sets of arguments about why we should be looking to vaccinate and share our excess doses abroad. Very, very powerful. I'm going to go to our final question, prepared question, to the pool group.
Yeah, hello, it's Helen here. And can I say, first of all, how sorry I am that you've lost 2 members of your family to COVID. That is just awful. And well, it's unforgivable that the rich countries hoard vaccines. Of course, in this country, we're very pleased that the COVID vaccines have been developed so quickly. But how can we make sure in future that the vaccines aren't hoarded by rich countries? It sounds so simple to say we should share them, but it obviously isn't.
Yeah, so if you look at so far the globe regionally around the world, how who's getting the vaccine and who's not, it's like, 80+% G7 or G7, G12 rich countries, and then Africa is less than I think 2%. And this is a function of these countries' ability to produce or not be able to produce the vaccine, develop and manufacture and distribute vaccines. It's a whole host of steps that countries have to go through. But one of the things that this incident has done is it has opened up a conversation about the structural barriers to equal access, and things like intellectual property rules, things like investments that are made in R&D. People are starting to talk about this because we work in health, but we weren't quite paying close attention to how the disparities around the world in countries' ability or regions' abilities to both develop or manufacture vaccines. It turns out that being able to manufacture a vaccine matters a great deal. Countries like the UK, US, Switzerland, Australia, and others who had the infrastructure to develop and manufacture vaccines quickly, they are doing relatively well, fairly well. They are covering their people at a pace that only their people are slowing it. But in the US, obviously we have that challenge. But the US is able to cover everybody in the United States in the next month or so if people actually showed up. But countries without the capacity to do so are far, far behind, as I said, in Africa. About less than 3% is covered so far. And part of it is the countries don't have the capacity to manufacture these vaccines. But even rich countries that didn't have the capacity to develop and manufacture have also suffered. Canada had a really difficult time in the beginning of rolling out because they didn't have an infrastructure to begin with, and it's something that they're now thinking about going forward, how they're going to invest in it. So the big issue is that we need to address these structural barriers, especially in poor countries. We need to have a serious discussion in global health, for us who work in global health, about the disparities in countries or regions' ability to respond and with vaccines, even drugs, other things. On the African continent alone, we manufacture less than 1%. We're able, not even we manufacture, but we're able to manufacture less than 90% of what we need. And there are only about 5 countries that have manufacturing facilities, but they can't actually produce the vaccine. They can get a vaccine that is already been developed and package it for distribution. And so we need, going forward, think about how we can help these countries have the capability, build the capability they need to respond, at least to manufacture, even if they can't develop. And this is my own criticism of the system as is in global health, is that we've spent the last 20 years working with programs like Gavi, the Vaccine Alliance. And, it's kind of shocking now that it never occurred to either them or other people to be like, geez, we need to have some level of preparation in the countries where they are helping people to be able to manufacture vaccines. So I think that these mechanisms, Gavi and others, are going to have these conversations to address this, and we will, hopefully, that will help us prepare to make sure that in the future we don't have this problem again.
Thanks, Wesa. Big issues you're raising there. And really, if we're looking at the long-term future of development, if we're looking at empowering people and countries in ways that are truly unlocking potential, then what you're talking about is where we need to be going with all aspects of our aid and development efforts. And really, I think this is a very compelling opportunity for us to really seize that way of thinking about how we do things. And so I think it's really important that as we look at this issue, as we've done over the last couple of months, we understand the need to urgently donate now, but we keep our eyes fixed on the longer term prize of self-sufficiency, that again, we can begin work on that right now. So thanks, very powerful answer, Wesa. We've had a couple of things come through in the chat. So let's jump over there. I'm double checking the phone. I don't think I've got a message through there, but I'll look at that again in just a second. So Emily asked a question in the chat around IP rights, which Harry answered. So do take a read of that one. We're not going to read that one out loud just now because we're trying to answer the other ones first. The first question was also from Emily. Why are we hoarding vaccines? Why are rich countries hoarding vaccines? Don't they expire anyway? Won't we have to pay to safely dispose of them if we don't use them? So doesn't it make sense to donate them? So Wesa, can you talk a little bit about how sort of the mechanics of that, and sort of where in the world are the vaccines, and what do we actually mean when we talk about donating vaccines in most cases?
Yeah, I mean, on the outside, it looks a little simple, like, it's very simple, countries are hoarding, but part of this has to do with, for example, Canada is a good example where they do have doses they purchased a long time ago, before there was even a viable vaccine. But a lot of the facilities or the companies from they purchased from have not necessarily made an effective vaccine yet, at least not the one that is being rolled out. And so it looks on the outside that they are hoarding, but if you look at it, they're not as much as maybe they are hoarding. So there's a little bit of understand, at least some level of like explanation to this. But in general, they're hoarding because some of them are actually thinking about using these vaccines, either charging for these vaccines or applying these vaccines toward international development support they give to countries, which will be a complete, completely immoral, in part because I would say these vaccines have almost zero value once they actually expire. But the other part is that they didn't do this. They didn't invest in this because they wanted to help poor countries. They invested in this for themselves because it made economic sense. Now it doesn't make economic sense for them to keep, I come from a family of farmers and we grow tomatoes. And my parents would grow a lot of tomatoes. And when you have, sometimes the season would be so big that there's nowhere to sell tomatoes. And keeping tomatoes that are going to rot in 2 days just doesn't make sense. So what we would do is we just give it to the village, give it to everyone else who wanted it, because that actually made more sense. So there's no need for countries to hold or to charge for these vaccines. They need to get these vaccines out. What's the second part of your question, if you don't mind, Aaron?
The question around the vaccines expiring. So if we have to pay to safely to pay to safely dispose of them.
Yeah, exactly. You have to do that as well.
Thanks, Wesa. Just to also build on that, I think Harry's again put some really great comments in the chat. Harry, I don't know if you want to speak to those as well, because I think they really help. Because this is quite a complex issue of hoarding. You know, as Wesa mentioned, you know, we're not always talking about actual vaccines in a warehouse, though we're sometimes talking about the right to buy a vaccine. So Harry, I don't know if you want to have a go at that as well.
Thanks, Aaron. Yeah, just building on what Wesa was saying and what Aaron was saying, we're not talking about sort of vials of vaccine sat on a shelf in a company somewhere that we package up and send to countries that are in most need. What we're talking about are deals that were made with manufacturers like AstraZeneca by rich countries that essentially then meant that COVAX, the facility to equitably distribute vaccines around the world, were then unable to access those vaccines because in essence they had already been bought by rich countries. So I hope that helps a little bit. It is quite confusing in terms of what we're talking about there, but there is an issue with expiration dates, in that there are sort of various levels of bureaucracy that come when you donate the vaccines. The processes from getting vaccines from factories into people's arms is often quite convoluted. I answered a question earlier about the intellectual property element of it as well, the fact that countries have to sign an indemnity release so that the companies can't be held liable were something to go wrong with the vaccines. This all slows the process down, and then we end up in situations as happened in Malawi, where I think 80,000 doses expired before they were able to be administered, which is a huge problem. Obviously, it creates issues as well in terms of the press around this and you know, disposing of vaccines. You've then on the flip side got the issue of vaccine hesitancy, where people are concerned that they might be given an expired product. So I hope that helps a little bit on that. I'm happy to try and provide a little bit more clarity in the chat.
Thanks, Harry, and apologies for not introducing you properly. Harry is our in-house COVID expert, been in the team for a few months now, and has really got quite a big job. Right, now let's see, what else do we have here? Oh, so wait, so two methodological questions. You mentioned a couple of numbers in your answer, I think, to the first or second question, around the total number of vaccine doses we collectively needed. And sort of like we're trying to hear from you, where did that figure come from? And then also in terms of the costing for global vaccine needs that you mentioned, the question was from Peter, and he asked, do these costings include the cheap cost of AstraZeneca? I don't expect you to know the answer to that off the cuff, because it's quite a big number. But do you know where are you pulling these figures from in terms of the overall cost? Who's doing that big top line calculation?
From Center for Global Development here in Washington, D.C. I think there's also actually the New York Times, as well as I think I'm forgetting another place where they track, I think it's Brown University here in the United States, where they're really tracking all these distribution, whatever, as it's happening right now. So a lot of, you can find, let me actually share a link here for some of this tracking.
Thanks, Wes. That's great. These are exactly the kind of links that our grassroots love, because those that are interested can go straight to the source and get the numbers. We've also got some numbers, plenty of that in our action and background materials for people to use too. For those that want to do more digging in, those are available there. Look, we've got 5 minutes left, so I'm going to ask anybody that wants to actually verbally ask a question to raise your hand or go off mute and just yell out hello, and then you can go ahead and ask your question.
Well, I've come off mute. I have a question if nobody else wants to jump in.
Please go ahead. Yeah, that'd be great.
So this might be a sidetrack because we've really been talking about donating the vaccines that wealthy countries have already bought. But there's quite a lot in the action material which is really about the TRIPS waiver and CTAP, I think it's called. And those two measures are about getting vaccines manufactured in the poorer countries of the world. So that's a little bit like, that's an extra topic, but it is in the actions material. My question that relates to that is, if we go down that route of getting vaccines manufactured in the global south, do we have a problem with regulation? In other words, testing of manufactured product and rejection of manufactured product that's substandard. Do we have a really strong regulation regime that will be able to work in that environment, or would that be a problem?
Thanks. I think that's a great question. It goes really well with one in the chat, which is, may manufacturers be concerned about quality assurance equivalence if other companies are given IP rights? Wait, so I don't know if you want to maybe tackle those in terms of the quality assurance and certification processes that vaccine manufacturers go through around the world.
Actually, I think Harry might be better positioned to tackle those two.
No problem. Harry?
Sure, yeah. Two very big questions. I think the question around IP waiver is a really interesting one, because what we need is sharing of intellectual property, be that through the TRIPS waiver, which essentially forces the hand of a lot of these companies, or be it through voluntary licenses or compulsory licenses. We need those recipes that have already been tried and tested and approved to be available for manufacturers in countries such as South Africa. And what we also need is investment in manufacturing, and we need the sharing of technology as well, because as one of our colleagues from Waki Health, who are based in Kenya, very rightly said to us the other day, even if you achieve the TRIPS waiver, even if the UK government and the German government stop their opposition and we're able to achieve a TRIPS waiver, that doesn't mean that just because we now have the recipe, we're going to be able to manufacture it tomorrow. We don't have the manufacturing capacity in country at present. So that's something that will need to come hand in hand with this IP, is that kind of investment in manufacturing capabilities. And at the moment, across the continent, I believe, and somebody please jump in and correct me if I'm wrong, but 99% of vaccines in Africa are currently imported. But there are manufacturing capacity in a number of different countries, and there's a lot of talk as well around different manufacturing companies who currently manufacture drugs for animals and vaccines for animals. There is capacity there, but it's again about bringing in the adequate financing to support upscaling those technologies, and that will be something that, as you quite rightly said in the chat, will need to be regulated. I can't speak too much to what there is in terms of those regulations at the moment, but that's something that will definitely yeah.
I can give a half a sentence on that, really. I mean, I think there is the World Health Organization, based in Geneva, has a large number of processes in place to verify and validate and check the quality of medicines and medical products in countries all around the world. And so, I think we should have faith in the system that should the capacity be being built in Africa, which, by the way, sounds a lot like a potential scaling up of investment. That's the sort of thing this government likes to do, right? All talking about investment and those sorts of things. That actually, we can trust the system, that the WHO will be able to move in there and make sure that everything that is being produced is properly tested, qualified, and safe. Let's trust the process on that, because we have processes in place to make sure. I'm really conscious of time, and I know that we've tackled what is a really complex topic, and we've dived in at a great deal of depth. But I'm desperately sorry to say that we have to call it to a close this evening. Really, Waiswa, just first of all, thank you so much for taking the time out of your day to be with everybody today. Thank you so very, very much for sharing your personal story. And of course, we're all so sorry to hear about the tragedy in your own family, and, you know, really heart going out to you and to everybody there. And I think just a stark reminder to everybody that while, you know, we might be arguing about exactly what percentage of the population needs to be vaccinated in this country and so on, and while many of us, I think, are feeling rightly nervous about opening up in just a couple of weeks' time, the story is very, very different globally. People are facing very, very different challenges. People are facing real hardship, real fear, real danger. And really, those are the reasons why we can't wait. Those are the reasons why we need to scale up the sharing of UK government vaccines, the vaccines we've already pre-purchased that we're never going to use. We need to get those out the door and shared as quickly as possible. It is urgent. I'm going to leave that there. And I really hope that everybody can take the campaign action and get moving on this. Waiswa, thank you just so much. It's been a pleasure.
Thank you, everybody.
But please don't go just yet. If people can stay in the line for just a few more seconds. One final request before we say goodnight. I mentioned earlier that we're going to, we'd like to return to the issue of the Global Partnership for Education, GPE replenishment. It's still coming up. It's where we've got that template letter action that hopefully you can take. If you remember, if you were on the call last month, we took a screenshot of you all, and this month we'd like to do it again. This time though, with everybody with their hand raised, as if you were putting up your hand to ask a question in class. What we're doing is we're stitching together hundreds of these Zoom images of tons of people together for a massive image to share on social media in the run up to the Global Education Conference. So we hope you'll be able to join us in sharing that image widely, which is going to include campaigners and colleagues, not from just the UK, but from all around the world. We've got Canada, the US, South Korea, Zambia, and Australia so far, with more joining all the time. So if you'd rather not be in the photo, then please do turn off your video just now. But otherwise, maybe you want to turn your video on. And then if you could give us a smile and raise your hand for just a second while Ruthie takes a picture, that would be really great. So let's do that now. Got a couple of pages, so give it a sec. Let us know when we're good, Ruthie.
Sorry, one sec. The previous screenshot was covering up people's faces in the bottom right, so I'm there now. Thank you, everyone.
Thanks so much, everybody. That's really good. So we'll share that image soon. Watch out for the hashtag raise your hand, all one word, and then run up to the start of the conference on the 28th of July. Thanks for staying on for an extra few minutes to do that. I really appreciate that, everybody. Thanks again to our guest speaker, Waiswa. And thank you all for your attention, commitment, and contributions this evening, and for all your advocacy efforts, as always. Goodbye for now, and I really hope you enjoy the rest of your evenings. Thanks so much.